Men, you like anyone else face many issues and challenges in life that bleed into your mental health, and it can show up as anxiety, depression, PTSD, bipolar, and many more. And I understand this is not talked about enough, and I'm a woman talking about it, and so I understand. Who am I to say I understand what you're going through? And that's exactly the issue in our society today. Women do not understand, and it's really important that I guide a community of men to start talking about it so that it's not unspoken anymore, simply. I'm not trying to pity you. I'm not trying to say you're weak. I'm not trying to further stigmatize you, but let's get the conversation going. And many times through your daily struggles of life and the pains and the mental health catastrophes that is embedded in your brain every single day through the journey of life, you found that overall maybe finding a good friend or having a good guy friend or a close loved one listen to you and you can talk about things and it can feel very cathartic has always been the antidote to getting you through the latest burnout, getting you through the latest projects that you have at work, getting you through the struggles of the relationship with your wife at home, or the catastrophes and the chaos with family and family planning and fatherhood, right? But what that does normally is it's very cathartic, and it's extremely disheartening to hear that that is one of the only tools that men have in trying to get a better outlook in life, is by finding someone to just affirm but not really create solutions, right? And so in today's video, this is what I really want to talk about. What is it that we can do as a community of mental health practitioners, and what can I do to help you be more proactive in your mental health processes and your mental models in life, and also what you should do in order to find a good therapist that is not just going to be a $200, $300 bill that is doing the same job your guy friend could have done to affirm and your emotions and say everything is going to be fine. Why don't you just go to the gym a little bit more often, right? Nobody needs to be paying that amount of money to get that kind of service. Not only understands the limitations and the issues that you're going through the journey of trying to be that top 10 percentile man while juggling being a father, being a good son, but one that understands how to address, isolate the issues and eradicate them, so you know how to solve it in the future. You solve it right now, and also how to prevent that from happening in your future life. So that's what I want to talk about today. Hello everyone, I'm Christy. I'm a therapist and a relationship coach, of course, but today you're gonna get more therapist side of me because this is what I'm passionate about. This is what I think is most impactful and the biggest issues and the blind spots in our current society today. So I'm very excited about today's video. So if you're new here, welcome, welcome, welcome. Please do me a favor and press the subscribe button and the like button. It helps the algorithm, of course, but it also helps me be able to continue creating really valuable content for you guys, because it's a issue and it's a problem that a lot of men need to hear about and learn so that we don't stay stagnant in life, okay? And society needs to hear about it. And of course, if you're old here, welcome back. Please, if you like everything that I talked about overall, give me a quick like as well. So before I start discussing what you can do after today's video, what are some solutions and some effective techniques that you should start looking out for, even if it's just you're sitting down with a bag of chips, you shouldn't be eating too much chips, and trying to understand your ruminating thoughts a little bit more, trying to understand how to find a good therapist. I want to go over today's agenda and what I'm going to be talking about in today's video so that we keep things a little bit more organized. Number one, firstly, I need to start talking about the limitations and the history behind why men specifically is having such a hard time finding services that can truly help you, okay? What in the limitations in our mental health industry as well as in society that makes it so hard for you to find services that can truly get you through some big life hurdles and your own mental mind, right? Number two, specific mental health issues that are extremely extremely more relevant to the male population than women, because this is very important for you to understand how to test whether or not the therapist is even going to be effective for you when you do sit down with them every single day, maybe once every week, right? And then also, what are some effective strategies that work better for the generalized population of men in comparison to your female counterparts? And I talk a lot of generalization here, but if you're a man and you're heterosexual and you identify as a man, you're who I'm talking to. I understand the sensitivities behind gender identity and gender fluidity, but this is not what I'm trying to talk about today. I want to go data driven. I want to talk to more the generalized population, and that's how solutions are formed. Okay, so first and foremost, let's dive into the history and the limitations a little bit, because it's really important for you to understand where you're currently standing in our society today when it comes to mental health services, and also where society is as a whole when it comes to driving the topic of men's mental health and debunking the fact that talking about emotions for men is weak and stigmatized, right? I get it. So historically, men have faced really unique barriers in therapy due to some societal and biological perceptions of masculinity, and the fact that psychotherapy has often targeted women. Always been a large population of women that chose to go and also found the most effective. Why? I can go into days about why that happens, but simply put, a lot of the practices used in the therapy industry today is extremely emotions focused. It's focused on acceptance, it's focused on compassion and affirmation, and that's what your guy friend could have done for you, right? That's one of the biggest issues in our industry today. So according to the American Psychological Association, released some new guidelines, okay? And this is specifically what I want you to highlight, because only in 2019 have new and improved guidelines that specialize with men and boys' mental health has been released in 2019. And although women still make up the majority of the therapy patients, men have reported symptoms of mental health disorders as an increase in similar rates, okay? But men and boys have underutilized mental health services. And another really big barrier in therapy for men, if you're marginalized, it's further complicated if you're Black, Indigenous, or a man of color. And according to the 2018 data in the American Psychological Association, only 4% of PhD level psychologists are Black, highlighting there is some sense of misrepresentation when it comes to the academic and research understanding behind how to better serve this population of men. Vastly different subjective experiences and backgrounds of men. However, one really good news is this movement of men's mental health and the movement in society and perceptions of men's mental health are starting to change, and this is partly due to the COVID-19 pandemic. And you may have heard a huge age-old movement, societal movement called Movember. And in Movember's 2019 survey, it has revealed that 4 out of 5, and this is done in Canada, Canadian men have prioritized mental health over work and romance. People are starting to welcome it. People are starting to open up the conversation and the possibility of putting this as one of the biggest power variables to improving your mental health and improving your life overall. To debrief is essentially, you're currently sitting in a huge movement where the Pandora's box has finally opened, but some of the industry standards and also some of the limitations are not being able to be caught up. Okay, and that's why you're seeing that the rates of reporting of symptoms and even men utilizing therapy in general are still at a very low rate. So this is something really important. It's not that there are no men out there struggling, it's that the industry has failed you to get caught up, right? However, a good positive is the movement has started. Okay, so please guys, I'm listening, and this is why I'm here. I'm sorry. Okay, seriously. obviously. So now let's talk about the mental health issues that has the ability to affect men a little bit more when it comes to the overall outlook of society, okay? Men often face unique pressures due to the narrow expectations of masculinity, such as dominance, right, power, and achievement. And it's always been the achievement markers or the value markers of what makes you powerful, top 1%, top 10% of today's day and age. And I don't think this should change, and I'm not trying to say or feminize you and try to coddle you in any way. However, through that process of trying to reach the top 1 percentile of our society, in between comes a huge painful journey and a war that just doesn't get talked about. And a lot of men and unspoken stories and struggles just gets completely wiped away. And this is what I want to talk about today. These pressures can negatively impact behavior, your self-worth, emotions, and in Canada specifically, huge trigger warning, please. The suicide rate for men is 3 times higher than for women, and men are 3 times more likely to suffer from any addiction or substance abuse. And these issues are obviously stemming from your pressures and the issues stemming from the crazy wars of trying to be top 10%, top 1%. And the mental health challenges stem up as depression and anxiety. And this is something that just never gets talked about enough, because if we are able to change those symptoms, more people are able to obviously reach their dreams. And I'm not trying to feminize you in any way, but through that journey, again, there are issues that arise that just never gets talked about. There's not enough tools for men to get through that. And so many men struggle to recognize or even name their emotions. And this is a phenomenon known as male alexithymia, okay? And this is due to the societal teachings and biological expectations, if you are a heterosexual man, to suppress emotions, okay? And this is leading to a really confusing and negative base mental health space for men. It can lead to sad feelings if you're childish and you're not acting like a man, right? Or the fake it until you make it analogy, going until you make it, right? And in between that, again, through that process, sometimes you don't make it. So what then, right? You will make it if you keep trying, but you got to keep trying. And sometimes through those struggles and those pressures and those biological markers and those pressures of society, a lot of people gets forgotten. So this mindset stems from obviously childhood, from society, and your biology as a man. And that's something that is a huge unspoken issue in our society that men deal with, okay? And some of the common issues found that mostly affect men, and I'm going to name a few in practice that I've seen, is restlessness and agitation, okay? Constantly feeling like you can never chillax. I get it. No one's telling you to chillax, but it's the inability to even relax even when you want to, right? Self-destructiveness when it comes to behaviors in relationships and those you care about. Restlessness to reach to the top of the hierarchy, but never feeling like you can stop or never feeling like you're enough. It's like a loophole that you get yourself into. Difficulty sleeping, ruminating thoughts of competition, and that there's a whole army of competition of men out to get you. It can either change that to a very proactive way, but sometimes it can get tiring, right? Changes in focus or this compulsive worry of that's affecting decision making, okay? Your list goes on and on and on with a ton of worries, a ton of things that you can do, and it affects your ability to even make decisions, okay? And very lastly is unexplained body aches or headaches. That's really very much correlated to burnout, having to fill out all of the roles in life as a man. Those are some of the most common issues that I found in practice, specifically to men. So again, very important that you find a therapist that understands this, not only knows about these issues, right? Understands it, but also knows how to eradicate it. When it comes to eradication, I'm going to talk about it in the very last portion of the video next when it comes to techniques, but understanding the limitations and also the issues that men's journey is going through, your wars of life, very important for you to find in a friend, but also in a therapist, of course. Now, very lastly, what are the effective techniques for men? Now, this is where paying a therapist $200, $300 an hour will be helpful, okay? If you are able to find a therapist who understands the limitations, understands today's day and age when it comes to the history of therapy and the mental health industry, and also understands the issues that you go through in separation from women in the female population, they can combine science-based techniques that is focused on eradicating the issues that you're going through so that you know how to form solutions to the problems that are happening in an ongoing basis every single day with your emotions, your thoughts, and your relationships, and your identity as a human being, right? So therapy is obviously not a one-size-fits-all, and I'm not here trying to create a brand new method, and that's not what I'm doing here. But a good therapist will create an environment that's tailored to your unique context and characteristics. Hence, they need to understand you to a T. It's normal, however, obviously, to feel completely unsure about therapy, and this is probably much a bigger issue for men when they're trying to go to therapy than it is for women. You're going to be a little bit more unsure about it, again, because in today's day and age, therapy is about talk therapy. You talk about it, you feel a little bit better, but you don't need pity, right? You don't need to complain. You want solutions. So again, you're unsure about it because what's the point really, right? And also, there's a huge stigma attached to therapy, mental health, and weakness, right? So I get it. It's completely normal to feel unsure about therapy, especially if you're a man new to discussing your emotions. However, the right therapist will avoid telling you to accept everything and just sit with their emotions, or maybe find some coping mechanisms like going to the gym and, dealing with it a little bit for maybe feeling a good about it for a couple hours, but no solutions are really formed, right? That therapist will focus on guiding you through a process with targeting behaviors and outputs and action-oriented plans and conversations that can be better towards the goal of a solution. So some research studies have shown recently, again, the conversation and the research has only started recently, that structured, action-oriented therapy is much more effective for men, and men have tend to respond better to therapy with a clear plan, direction, visible progress, and attainable skills, okay? So explaining the process up front and taking more of a practical, applicable, measurable approach, like teaching emotional vocabulary words that you can actually see in front of you and test out in your relationships, and how you talk to your mother or your girlfriend or your wife are extremely effective tactics, okay? Not just talking about emotions, but tangible solutions and tactics, okay? Finding the right therapist that understands where to find these tactics, that she has these tactics or he or she has these tactics, is extremely crucial then for you as a man, and understanding how your brain works is also extremely important. So men oftentimes can benefit from various types of therapy. Again, not one size fits all. I'm not saying emotions are not important at all. It normally is very much important. However, if you are looking for someone who understands how you work and how your brain works, I would suggest looking for a therapist who focuses on these specific techniques in practice, okay? So behavioral activation techniques, ones that's going to get you to perform and take action on things that you find a little bit hard to activate on, okay? CBT, cognitive behavioral therapy, you understand what you should bring an issue up, you find a couple causes and you try to eradicate it with behaviors that you can change and some tools that you can change in order to have a better output in life, right? Better output in general. Solutions focused therapy, ones that is going to be directive, straight to the point and straight to the issue and straight to the problem and then solving it. And very, very lastly, and this is not widely practiced and it's a huge issue, it's data-driven techniques that measure progress, because it's really important for you to understand when you're spending time every single week, an hour a week maybe, or a couple hours a week going to these sessions, that you are actually improving your overall outlook and output in life, and that therapy is actually doing a good job for you, right? Like it's doing something. So data-driven techniques that measure progress that you can see. It doesn't have to be perfect. There are acceptances for failure rates and things like that, right? But you can see your mental health and your lifespan across the spectrum is on an up level trend, right? So a really, really interesting technique that I use in the early stages of therapy is understanding that men think and feel and react to scenarios completely differently than women, right? Surprise, surprise. Why are we just starting to talk about it today? So when you're angry, doesn't mean you're angry or that you're trying to attack someone. Sometimes it could mean that you feel tremendous anxiety, you need to prove that you are not weak, right? And so sometimes the anger comes out as women or people see it as you can't handle yourself, but it's truly you trying to show that you have a handle of things, right? So one of the biggest approaches though that I like to use in the early stages of therapy, and I want to give you a taste of it, is essentially called internal family systems therapy. It's really complicated. I don't want to complicate this video too much. I can go days and days about talking about it, but simply it's trying to identify the different parts of yourself and it's trying to isolate really quickly what is causing the most dysfunction at any given time in any given scenario. So in session, there's either 3 parts of yourself normally or tendencies that you normally tend to react to certain scenarios. And there's the firefighter, there's the manager, and then there's the exile. These are normal tendencies that men tend to fall into when it comes to habitual problem solving or reactions to conflicts or stressful situations, okay? So the firefighter, normally the word gives it out, you are always out to put out the pain. It can be through solutions, it can be through, honestly, substance abuse, okay? So across the spectrum, however, you're a firefighter, you're always out there trying to take away the pain, okay? The manager, always trying to protect yourself or others from pain, so you tend to be kind of controlling and critical about other people, yourself, and the world, okay? And then very lastly, exile, it's the one that is the most painful one. You suppress the most painful parts of yourself or your relationship. You have the tendency to be the community unifier. You tend to not want to talk about your emotions or not even know where your emotions, that you have emotions, numbness. When you tend to have these 2 facades that you're very happy on the outside, but you're extremely isolated and incomplete on the inside. And so understanding though how you work as a man and what you tend to gravitate to. Are you the type to want to put out the pain? Are you the type to want to protect others from pain? There's a difference. These are the 3 examples that I normally use to help men understand the different parts of your makeup sometimes when it comes to this specific therapy tactic, and it helps you understand and recognize where your tendencies are coming from. Do you tend to be a manager or do you tend to exile? If we can find your tendencies and when their tendency lies, you can understand where the positives and negatives are coming from your habits and tendencies, and we can form various alternatives and tactics in which you can use differently next time. So if you tend to be a firefighter, maybe there are scenarios that you can be a little bit more of a manager, right? Or if you tend to be a manager because at work, maybe you're a manager all of the time and you bring it to relationships, then maybe there's a need to be a little bit more of an exile. You might need to suppress your emotions a little bit to listen to her a little bit. So there's always solutions as long as we find where your tendency lies, who you are as a person, and what your habits are, and where your issues are coming from. So I hope you liked today's video. Please, guys, do me a favor. Please comment down below what was the most valuable thing that you learned from today's video. I want to wrap this video up by addressing the fact that there are huge limitations in our current mental health system. There are huge problems when it comes to even the conversations surrounding men's mental health. Although the positives is that the movement is starting, and the data when it comes to how the population is responding understanding and the struggles that are going through is that men are struggling a lot. So I want to wrap things up and say I'm very sorry as a practitioner that only recently have we started this conversation. As a woman, I'm also sorry that we were taught that you guys didn't have issues just because we didn't hear it. And I also hope you gain some value as to what you should be looking for when it comes to finding a good therapist, and also creating more conversations around how to guide people to better understand you. What are your issues? If you're anxious, right? How does it show up? How is your life different from a life from a woman? Start having those conversations so that the conversations start. So let's start today. Comment down below. How is your life different? And what are things and aspects and perspectives of life that you normally don't like talking about because you get attacked by society that has made you isolate yourself a little bit more? Write it in the comments below, okay? Love you guys all. Maybe I'm a woman and I'm a nurturing type and I say that a lot, but please guys, it's extremely important that you put action to the words that you're saying you want to do, which is, if I want to improve my mental health, it starts with being proactive, and it starts by finding someone who can truly help you. Okay, thanks guys, thanks for joining me, and until next time, bye guys. Hi everyone, if you enjoyed our content, don't forget to follow us on TikTok and IG where we post daily, and YouTube where we post weekly.